Hi everyone, my name is Sarah King and I am a nurse on the surgical trauma ICU unit at UVA Health, and today I will be discussing a recent ethical dilemma I faced at my job. So a few weeks ago I had a patient come in from a motor vehicle accident and he had extensive injuries. He had multiple bilateral rib fractures, he had a right femur fracture, he had a right ulnar fracture, and he had multiple bruises, abrasions, and lacerations over his chest and torso. So this patient was in a lot of pain from his injuries. However, he was adamant that he did not want to receive any pain medication during his stay at our hospital. He was afraid of the adverse effects of the medication, and he was afraid of any risk of addiction, and he was the type of person who just didn't normally take medication, and he didn't want to start doing it today. However, he was in very obvious discomfort from all of his injuries. His heart rate was up, his blood pressure was up, he was grimacing, and he was just very obviously in pain. His family was at bedside and they were very adamant that I still give him the pain medication. They didn't want to see him in pain, and they were telling me that I should just go ahead and give the pain medication to him, that he didn't know what he was talking about and that he needed this medication. However, this patient was fully informed, had full capacity, he was completely alert and oriented, and so he had made the informed decision to not receive pain medication. So this created an ethical dilemma for me, as obviously I wanted to help the patient be in less pain, but I also, by the ANA Code of Ethics Provision 1, the patient has the right to self-determination, and this patient had determined that he did not want this treatment. So this put me in a bit of a tough spot of trying to provide patient comfort, of trying to appease the family, but also following the patient's wishes and being an advocate for the patient, as is also stated in ANA Code of Ethics Provision 1. I also was bound by ANA Code of Ethics Provision 2 of putting the patient's well-being as my number one concern. And I knew that if the patient continued to be in uncontrolled pain, his condition and his prognosis was going to deteriorate, and that he needed some type of pain control so his body could heal. So in order to fix this dilemma, I came up with the solution of beginning with low regimen pain management for the patient. So I offered the patient, he had ordered Tylenol, and I offered to give him the Tylenol and reposition his leg and arm to try to provide some comfort for him. The patient did agree to take the Tylenol, and so I repositioned him and waited about 20 minutes and came back in, and the patient's pain was still not controlled. So I educate the patient once again. I let him know that with his extent of injuries, he would most likely not find pain relief from a medicine like Tylenol, and that he would need something stronger. I also educated him on the risk and benefits of the pain medication. I educated him on any the tools and skills we use to determine if a patient is being overdosed or showing signs of addiction. I assured him that that was our number one priority, was to only provide comfort and to minimize the risk of other adverse effects. And I educated him on the negative outcomes if he continued to let his pain be uncontrolled. So after all of the education I gave him, after seeing that I wanted to follow his wishes, after seeing that we started off with a low dose pain regimen, that I tried everything that I could to honor his wishes, but also by the Code of Ethics Provision 2, put his well-being at the forefront of my actions, he realized that I was being an advocate for him, that I was listening to him, and he trusted me that I didn't just give him the pain medication from the start. And so he finally did agree to take the pain medication, and he was able to receive some comfort from that. But what I learned from this event was that you must follow the patient's wishes, you must be an advocate for the patient, and you must create a trusting relationship with the patient and honor their desires. And when you do all of this, sometimes they will eventually come around to the treatment that you're trying to provide them, but that is the forefront of our priorities as nurses, is to listen to the patients, to be safe, and to create an honest and trusting relationship.